Hello everyone, I am Dr. Pawanindra Lal. I am currently Senior Consultant in the Department of Minimal Access, Robotic, Laparoscopic and General Surgery at Indraprasth Apollo Hospital, New Delhi. Prior to this, I was the Director Professor and Head of the Department of General Surgery at Maulana Azad Medical College and the Chairman of the Division of Minimal Access Surgery as well in the same department. I have also had the opportunity to be the Executive Director of the National Board of Examinations in Medical Sciences for a period of 2 years during the period of COVID. And during my tenure in Maulana Azad Medical College, I had the opportunity to establish the first of its kind Clinical Skills Center way back in 2005, which went on to become the first and the largest such facility in India, and also won the FICCI Healthcare Award in the year 2014. We also had the opportunity to start one of the first metabolic surgery clinics in the year 2010 and the FNB program in minimal access surgery under the National Board of Examinations in the year 2011, which was also the first such FNB program in the entire country in any government institution. I was also able to help the institution in starting the first of its kind surgical endoscopy services, which was covering both upper GI and lower GI endoscopy. Again, a first of its kind in any department of general surgery in any government institution. During the period of my professional career, I have been able to be associated with a large number of bodies, professional bodies. Currently, I am chairman of the Surgical Sectional Committee of the Bureau of Indian Standards for the Government of India. This particular committee is responsible for making the BIS standards for general surgery, pediatric surgery, plastic surgery, urology, and all the allied gastrointestinal surgical departments. So it's a very big committee and it is known as the MHD01 for the Bureau of Indian Standards. I am also the president of the International College of Laparoscopic Surgeons. I am currently a member of the National Executive Committee for the Obesity Surgical Society of India and the ARIS, which is the Association of Robotic and Innovative Surgeons. Currently, associations have got leading role for the obesity surgery standards and for the robotic standards in the country. I have served as the past president for the Society of Endoscopic and Laparoscopic Surgeons of India, SELSI, and the India Hernia Society. I have also been the past president of the ASI Delhi chapter. I have also been the National Executive Committee member for the ASI and for the Indian Association of Gastroendoscopic Surgeons from the year 2019 to 2024, that is the entire 6-year period. During my academic career, I am very fortunate to say that I have been associated with the book Bible of Surgery, that is Bailey and Love. And since the 25th edition, I was invited to be an author of the chapter called Tropical Surgery, along with my colleague authors Dr. Sanjay Debakshi and Mr. Pradeep K. Datta from UK, who has been my teacher and mentor in general surgery since 2000. In the last edition of the 28th edition of Bailey and Love, I was invited to author another new chapter, the chapter number 70 for the spleen. And this year again, for the 29th edition, I have been invited to be associated with both these chapters, and this is a very big honor, and I thank the editors of the Bailey and Love for having reposed their confidence in me. Other than this, I have also had the opportunity of publishing more than 100 papers in national and international index journals and presented over 350 talks as invited speaker at various national and international forums. It has been my passion to be very staunch clinician and try to teach clinical sciences to all my MBBS and postgraduate residents, and these clinical science have been taught over the span of the last few years, and some of these are evident through the surgery update program that was held by Maulana Azad Medical College's Department of Surgery, which has been one of the longest serving national CME programs, and I had the opportunity to be the organizing chairman of this surgery update at MAMC during the tenure of my headship. I am also keenly interested in sports, and I always encourage everybody to remain active, and sports is one such medium which helps you to remain physically fit as well as mentally relaxed. And for this, I have been encouraging and I have been organizing tennis tournaments in my own locality, where we run tennis tournaments on clay courts. I have also been associated with organic farming. I staunchly believe that the reason why cancers are on the rise is because more and more of polluted and contaminated food is being consumed by us. So if we can go back to our basics, go back to organic farming, we might be able to remain protected and prevent our future generations also from getting the curse of cancer. So I had an opportunity to have a collaborative formed to grow organic vegetables nearby Delhi in an area which did not have any industries outside, so that the water that we get is not polluted, the subsoil water is clean. And I also am very keen to reduce the garbage, and all the kitchen waste is one thing that adds to the garbage of the city. So I started a collaborative in my own area for composting and home composting, where we encourage all the families to firstly segregate their biodegradable waste from the paper and plastic waste, and then use this kitchen waste to be made into home compost, which is known as black gold. This can be made in earthenware pots, and over 45 days time, this can become the manure for organic farming in each of our homes.